imagine you are missing one part of your body, a finger, your eye, your appendix. You could still physically survive. But what if you were missing one other part? What if you were missing your blood? Blood isn't just one part of your body, it's what everything else requires to live. Without it, everything shuts down. Good morning, I'm P.V. Burrows-Thieball, a 10th grader from Cobb County, and today I'll be talking to you about blood diseases and disorders, specifically anemia, leukemia, and sickle cell disease, and then also the importance to me. So first, let's start with the basics. Blood is classified as a fluid connective tissue. That's because it's made up of plasma, which is 92% water, so that's the fluid. It's connective because it travels the entire body. And it's considered a tissue because it's made up of functional cells. It has three main jobs. Red blood cells deliver oxygen, white blood cells fight infection, and platelets help clot the blood. Let's start with oxygen delivery because everything else depends on it. So, red blood cells carry a protein called hemoglobin. Hemoglobin attaches to oxygen in the lungs and releases it to all the tissues in your body. Each hemoglobin molecule has 4 binding sites for oxygen, and each red blood cell contains approximately 270 million hemoglobin molecules. That means a single red blood cell can carry over 1 million oxygen molecules. At rest, you have 4 to 6 million red blood cells in your body, and they carry that oxygen all around your body. But if your heart rate is up, then there will be more, your body will have to produce more blood. But here's something cool about hemoglobin binding. The first oxygen molecule is difficult to attach, but then the second two are easier because the molecule itself changes shape. And the oxygen delivery also isn't passive. Your heart rate increases based on activity, and your blood vessels constrict or dilate depending on where your body needs blood. Now let's talk about immune defense. So white blood cells don't just float around randomly in your blood. When an infection occurs, chemical signals are released, and white blood cells can detect these signals and follow them to the infection. We can see in that diagram that they will also go through the cell or the blood vessel wall in order to get to the bacteria or infection. Now let's talk about platelets. They're another important part of blood. They're cell fragments that work with proteins in your blood, specifically the clotting factor proteins, to help clot your blood to prevent you from bleeding out. When a blood vessel tears, the collagen underneath the vessel wall is exposed. The platelets then get those chemical signals and go there and bind to the collagen. Then also all the proteins attach as well. But balance is critical. Too little clotting could cause you to bleed out, but too much can cause a clot, which can be a dangerous blockage such as a stroke in the brain or a pulmonary embolism in your lungs. Blood is a system of opposites in balance. Clotting versus bleeding, immune defense versus tolerance, oxygen delivery versus demand. And when that balance fails, disease can happen. So let's talk about our first blood disorder, anemia. Anemia is one of the most common blood disorders, and it affects 3 million people in the United States. It's caused by a lower than normal amount of oxygen or hemoglobin in the blood, which reduces the blood's capacity to carry that oxygen around. And it can cause fatigue, weakness, dizziness, and shortness of breath. As we talked about earlier, red blood cells contain the hemoglobin, which carries oxygen. With anemia, hemoglobin levels are too low, and that reduces the carrying capacity. And the cells will receive less oxygen, and then energy production in your body decreases too. All the cells in your body generate energy through something called ATP, which is adenosine triphosphate. It's essentially your body's battery. It powers muscle contraction, digestion, and even thinking. But when ATP production depends on oxygen, when there's no oxygen, the production drops, which leads to that fatigue, brain fog, and dizziness, and increased cardiac workload. So when hemoglobin levels fall, the body detects tissue hypoxia, which is a scientific word for oxygen deficiency. The heart will beat faster, and then blood is prioritized to your vital organs. Then the kidneys will release something called erythropoietin, or EPO. EPO signals the bone marrow to increase red blood cell production. But if the kidneys can't produce enough EPO because the ATP levels have dropped, then that signal is lost, and you can't produce any red blood cells, or as enough that you need. And even if your iron levels are normal. Anemia is classified by red blood cell size. Microcytic, or small cells, are usually from that iron deficiency, and are the most common. Macrocytic, or large cells, are often from impaired cell development within the bone marrow. And normocytic are normal-sized cells, but decrease production or increase destruction of the individual cells, as you can see in that picture. Most cases of anemia are easily handled with common health management, such as drinking more water and increasing your iron levels. Now, let's talk about sickle cell disease. Have you ever been near pink house insulation and gotten fiberglass stuck in your hand? Or maybe you've been washing dishes with steel wool and you cut yourself. Or maybe you've gotten poked by a cactus or a rose. That can be fixed with some cool water and tweezers. But I want you to take a moment to imagine this. So you have a glass of water and you're drinking that water, but suddenly it shatters into 1,000 pieces and you swallow, and that is all through your body, in your arms, your hands, your veins. You feel that. And that is what sickle cell disease feels like. So, sickle cell disease is an inherited red blood cell disorder, and it's caused by a genetic mutation that makes the blood cells hard, specifically the hemoglobin inside. The trait must be passed on by both parents for the child to have the disease. In 1949, a major discovery was made by Dr. Linus Pauling. Sickle cell disease was the first genetic disease understood at the molecular level. He and other scientists identified a single nucleotide related to, or a change in the beta globin gene. That means one amino acid, which is glutamic acid, was replaced with valine, and they have opposite chemical properties. So one is hydrophilic and the other is hydrophobic. So when those oxygen levels drop, the mutated hemoglobin molecules, they stick together and they form little rigid rods inside your blood. And those cells become stiff and sickle or crescent shaped, as shown in that smear. So, and that can cause chronic pain, infection, and even anemia. And that blocked blood flow will lead to the oxygen deprivation and the pain. Then the spleen, which is what essentially cleans out your blood, will become damaged, which increases infection risk and stroke risk, especially in children. So while it's not exactly glass, that's what it feels like when sickle cells block your blood flow. For an unaffected person like you or me, you don't feel your blood flowing through your body at all. And researchers have discovered that fetal hemoglobin, so hemoglobin in the blood of fetuses still in the womb, doesn't sickle at all. So they're still trying to figure out a way to fix adult hemoglobin to mirror that. And modern therapies want to do that, and they'll also use editing stem cells to protect the hemoglobin production. So sickle cell disease demonstrated that one molecular mistake can affect every organ system, and it laid the foundation for gene therapy too. Now let's talk about our final disorder, blood cancer. Leukemia is one of the 5 main blood cancers, and it's one of the 3 that affect children. Leukemia is a cancer of the blood and bone marrow, so from inside the bones, where the body produces too many abnormal white blood cells, and that affects the platelets, healthy red blood cells, and healthy white blood cells. But this cancer isn't just uncontrolled growth, it's also a breakdown in cellular signaling. So in chronic myeloid leukemia specifically, which is one of the variants, chromosomes number 9 and 22, they swap segments, which forms the Philadelphia chromosome. And it was discovered in 1960 by researchers at UPenn in Philadelphia, or University of Pennsylvania. This creates a fusion gene called BCR-ABL, and which produces the protein that constantly signals the cells just to divide and divide, and that growth signal just never turns off. So remember those white blood cells we were talking about earlier and how they activate during infection? In leukemia, your body can sense that there's a cancer or an infection and is trying to produce those white blood cells, but since those chromosomes are swapped, they produce malformed white blood cells that aren't doing their job and overtake the normal white blood cells. As you can see in the second slide, we have our normal one and then we have the 2 malformed ones. So cancer cells also reprogram metabolism, and that shifts all the energy towards the rapid growth of these cells rather than normal function. So for decades, chemotherapy, which is chemical drugs, killed all rapidly dividing cells. But then came a breakthrough in 2001. There was a drug marketed as Gleevec, and it was the first targeted cancer therapy breakthrough for chronic myeloid leukemia. It specifically blocks our BCR-ABL gene, and it targets that specific molecule rather than poisoning all the dividing cells. So this transformed both hematology and oncology. So tumors can now be sequenced and they can personalize treatments to the individual cells inside you. Leukemia also advanced bone marrow transplantation and CAR T therapy. So that's where a patient's T cells, which is one of the 4 types of their white blood cells, are removed and genetically engineered, and they take their DNA so it can only recognize those specific cancer cells. So blood cancers have become the foundation for immunotherapy. So all of this was very a scientific overview, but for me, blood is also personal. So 8 years ago, my mom developed a superficial blood clot in her leg after a fall. And when she went to see the hematologist, 8-year-old me went along, and I was super interested. And I already knew I wanted to be a doctor at the time, but that is when I decided I was going to become a pediatric hematologist. Then 5 years ago, my grandma got massive saddlebag pulmonary emboli, or blood clots in the lungs, from a suspected genetic reaction to a vaccine. And there isn't a clinical test to find the genetic marker, but it medically fits. So my interest in hematology didn't really come from any class or book. It came from seeing how something so tiny that is in us all can really change a life so fast. So today, I've only talked about 3 of the blood diseases, disorders, and cancers, but there are so many, and I look forward to working on those as a future pediatric hematologist. I specifically want to do pediatrics because there's so many that are, the very specific ones are often related to kids, infants, and young adults. So blood is our liquid connective tissue, and it travels everywhere in the body. It delivers our oxygen, it fights infection, and it keeps us from bleeding out. But it can also cause problems. And it also is what connects our whole entire body by all that cellular communication. So through studying blood, scientists learned that one molecular error can affect every organ system, that growth is controlled by those signals, and that gene editing can change people's blood for the better. So hematology may just be the study of blood, but it affects so much more than that. It affects medicine as a whole and your body as a whole. So thank you for listening to something I'm very passionate about. I know it may not be your favorite. My twin sister definitely can't stand it, and my judge in 7th grade wasn't a fan of blood at all. But thank you, and I hope you learned something new.